Today we're going to focus on an issue that affects everybody, especially older adults and their families: falls prevention and staying active and independent for life. Did you know that 1 in 4 Americans over the age of 65 experience a fall at least once a year? The good news is that most falls are preventable, and with the right knowledge and strategies, we can all take steps to reduce that risk, stay active, and maintain independence as we age. We're fortunate today to have 2 highly skilled experts who dedicate their careers helping people stay strong, safe, mobile, and independent. Our first speaker is going to be Lauren Morris. She has a doctorate, Dr. Lauren Morris, excuse me. She has a doctorate in physical therapy, and Lauren has spent the last 5 years working with patients in the outpatient setting. Her passion is helping individuals improve balance, strength, and confidence in their everyday lives. Our next speaker will be Dr. Sarah Jane Malone, who also has a doctorate in physical therapy, and she's a board-certified geriatric clinical specialist. Sarah Jane brings over 11 years of clinical experience, 9 of those years in skilled nursing and the last 2 years in outpatient care. She works daily with older adults to maximize their mobility and quality of life. They both work at having a wealth of experience and practical strategies to share with us today. They're part of their neuro team at PRISMA Health Total Rehab at Springbrook. I want to welcome Dr. Lauren Morris and Dr. it's hard for me to say that, Sarah Jane Malone.
So first off, just talking about what is balance. So balance is an even distribution of weight enabling someone or something to remain upright and steady. Keeping or putting something in a steady position so that it doesn't fall is also a form of balance. So how does our body maintain balance to help keep us from falling? So there's actually a few different systems in our body that all work together to help us keep our balance, and that is our muscles and our joints, so our musculoskeletal system, our eyes, our visual system, our proprioception, or just our ability to sense things in the joints and the skin, and then our vestibular system, and that is your inner ear. So if any of those systems have been affected in one way or another, that can in turn affect our balance. So first we'll look a little bit more in-depthly into the muscles and the joints. First, we want to have good strength. If we don't have good strength, if we have some weakness in an area, that is going to contribute to issues with our balance. Most importantly, I would say hip strength, core strength. If we don't have a stable center, everything else is going to be affected. Other things that can be affected in the musculoskeletal system is just the endurance of muscles. So even though sometimes muscles can have good power, they don't have a long battery. So if they tire out quickly and they fatigue, then that is again going to affect balance and our quality of movement and all those things. And then lastly, we've got power. So just the ability to quickly react, to do a sudden movement. So say we're walking, we lose our balance. Do we have the power to be able to quickly react and recover ourselves, or are we having some issues with that? Also, joints. So the joints of the knee, the joints of the hip, the joints of the ankle, if any of those have had some kind of injury, if they're restricted, maybe that joint's just really tight, doesn't move as well as it used to, maybe we have pain in that joint, that can also affect our balance. So here we have a test where you can assess muscle strength a little more in-depthly. It's a 30-second chair stand. It's very easy, where you are assessing yourself and how well you're able to do a sit to stand, and then it can give you some more information based on your results. So next, we'll look at the visual systems. If we have any kind of issues with our visual system, whether it be maybe our field of vision has been limited for some reason, or if we can see but maybe everything's blurry, that is going to affect our body because the input that our brain is getting isn't as good as it could be. So for this slide, I will say, go to your eye doctor regularly. If you have been prescribed glasses, contacts, make sure you're wearing those as prescribed by your doctor, because it really does play a big role if we can't see our environment well. Visual tracking, so that is just our ability to follow objects, being able to see when things are moving, how are they moving, and in relation to us so that we can adjust as needed. So I would say an example for this is maybe you have a pet and your pet is walking towards you. Can you see where that pet is going so that you can avoid them if needed to keep your balance? So again, with this, I will say really important, going to your eye doctor regularly, getting your vision checked so that if there's any deficits, they can be addressed appropriately. Next, we have vestibular system, so that is your inner ear. The vestibular system is actually really important in keeping our balance, giving our body a sense of direction, and if there's issues with that, again, it can affect our overall balance. So the input that it gives to our brain is it tells us if our body is moving, what direction is it moving in, how fast is it moving. If you've ever been on a merry-go-round or a roller coaster, as in the picture, and maybe afterwards you feel a little disjointed, a little dizzy, that could be your vestibular system saying, hey, I'm trying to figure out what is going on right now. So if we have issues with that, again, can affect our balance. If you've ever had anyone that's experienced dizziness, or you yourself have experienced some dizziness, then not always, but that could be some input from the vestibular system saying, hey, there's something going on. Here is an example more of something that we do in the clinic if we are working with people that do have issues with their vestibular system. So in the top pictures, you just see us doing some exercises in the clinic to address those needs. The next system that we'll look at is proprioception. So that is our skin, joints, as I was saying earlier, just your body's ability to sense things. So if we have neuropathy, that can affect our proprioception. If we have had any kind of injury to an area, that can affect our proprioception. Maybe a joint hasn't got to move for a while. Say we roll our ankle and we're in a boot for a few months, we come out of that boot, the proprioception in that joint where it hasn't got to move has been affected. And so sometimes that can send some disjointed signals to our brain. And again, if that be the case, that is something that can be worked on, or we can try to adapt around that and make those other systems work for us as best as possible to help with our balance. Getting into a standing position, taking your shoes off, just being able to sense, can you feel the ground? Can you feel your weight shifting from leg to leg, different areas of your foot, is a good way just to see, like, how well is my proprioception, or are there some issues with that? In summary, our innate body systems work together to allow us to maintain our balance while performing activities that we enjoy. And again, the big picture is that if any of those one systems are affected in any sort of way, they can have a bigger role in our balance. Even if it may not seem like it at the time, it really can. Just talking with your doctor if you have any of these changes occurring with any of these areas or having any issues, so that again they can be appropriately addressed, whether that be with your doctor, whether that be going to a therapist for physical therapy or going to your eye doctor and so forth. Next, I'm just going to talk about what happens with our body as we go through the aging process. So, aging is a normal process. It happens to everyone. And there are things that occur that if we don't address them appropriately, they can affect our balance. But it's also something that we can work to try to fight against, to maintain ourselves and maintain our independence. So some things that we'll see is a loss of muscle mass over time, decreased bone density, reduced sensory feedback, so that's going back to the proprioception I was talking about earlier. Possible reduction in joint and muscle flexibility, decreased function of vestibular system, so that inner ear, decreased cardiopulmonary output, so if we have any cardiac issues, decreased reaction speeds, visual changes, all of those things can affect, again, balance. One of those alone is enough to affect, but if we have multiple of those, then even more so. Just like I was talking about a second ago, good news. You can address some of those issues that happen with the normal aging process. Staying active is a great way to address the physical components of things, the muscle mass issues, the decreased flexibility, joint stiffness. So it is recommended that we get 150 minutes of moderate intensity aerobic activity every week. So for moderate intensity, there can be a lot of gray area with that, but I would say moderate is where you are starting to feel like you're doing something. You're getting a little bit winded, you're getting a little short of breath. To really get that cardiopulmonary benefit from the exercise. And we're going to try to do that twice a week, some muscle strengthening activities on 2 or more days a week that work on major muscle groups. So thinking our core, our lower extremities, even our upper body is important to work on too for balance control. Unfortunately, even though it's been recommended that we get that moderate intensity and we get that through the week, research has shown that only about 9% of adults 65 or older meet those recommended guidelines. Some activity is always better than no activity, right? But if we can really try to get as close to meeting those guidelines as possible, that's what's really going to maximize the benefits of that activity, where you can notice those changes and feel like, this is worth my while. So lack of physical activity in general can lead to some decreased flexibility, decreased muscle strength, worsening balance, decreased function of our vestibular system, that inner ear. Falls, as you all already know, I'm sure, can lead to injury, decreased mobility, decreased fun, decreased independence. So next we'll talk a little bit about why do we have falls? And that is a loaded question. World Health Organization defines a fall as an event which results in a person coming to rest inadvertently on the ground or floor or other lower level. Sometimes I'll have people say, well, I tripped, but it wasn't really a fall because I landed on my bed. Good. Glad that you landed on the bed and you didn't hurt yourself, but I would still count that as a fall because it wasn't an intentional movement that you did. Same thing for any other surfaces you might land upon, even if it be the wall. I'm still going to consider that a fall. Falls occur when the center of gravity moves outside of a person's base of support. So our base of support is when we are standing, we're centered, where are our feet at? I am over my base of support right now. If I get outside of my base of support, then that's when we have that potential for falls to occur. Over 50% of falls from a community-dwelling older adult occur from a slip or a trip, and the person is normally walking in a forwards direction. Here are some statistics on falls. So in 2020, There were 970 deaths reported related to falls just in Tennessee, and 812 of those deaths occurred in individuals over 65 years old. So that's just to say that falls, they are a serious thing. They don't always result in an injury, but there is that likelihood, so it's so important for us to try and really address them when they start occurring. So according to the CDC, more than 1 out of 4 people 65 and older will have a fall. Falling once doubles your chance of having a fall again. And 1 out of 5 falls can cause a serious injury, such as broken bones, head injuries, etc. And then those injuries, even if it just be a broken bone, that can be a serious injury that affects your independence, it affects your function. So then that can lead to more decline if we don't get the chance to address it. Each year, 3 million people are treated in emergency departments for fall injuries, so it's a common occurrence. So what factors can increase our risk for falls? We already talked earlier about the physical aspect of things and how if some of those areas of systems are affected, that can increase our risk. And then here we have some simple questions. And if you answer yes to any of these questions, you do have a higher risk for falls. So have you fallen in the past year? Do you feel unsteady when you stand or when you're walking? And then do you worry about falling? Because our confidence in our own balance can affect the way that we move. And if it's affecting the way that we move in a negative manner, that can also increase our risk. Following this up, looking at more factors that can increase our fall risk. Our environment, so home safety, footwear and assistive devices. Are we using the appropriate assistive device? Are we using one at all? And are we using it correctly? Those are big things. Medications. So some side effects of medication sometimes can cause dizziness, things like that. That can be a contributor. Illnesses, diseases, poor eyesight, as we talked about earlier. Poor hearing can also affect our balance. Dizziness, just age in general, incontinence issues, memory issues, chronic pain, because again, that's going to affect the way that we're moving. Any swelling that's occurring in the hands or the feet, but especially the feet, because again, that could affect the way that we're walking and moving and how our balance is. Depression, and then just musculoskeletal issues. Some of these aren't direct reasons for an increased fall risk, but they can lead to other issues that could increase our risk for falls. Some common musculoskeletal issues that can increase fall risk. And this is going a little more specifically just into the muscles, strength issues, and how if we have some weakness in these muscle groups, we could be at an increased risk for falls. So first we've got quad weakness. So the front of your thigh, that is the muscle that extends your knee. If you have some weakness there, that can affect you when you're standing up, when you're going up and down stairs. Your hip extensors and abductors. So think more the side to back of your hip, your bottom. Your calves, so your lower legs. Limited range of motion. So maybe we have decent muscle strength, but the motion in a joint is affected. That can affect our risk for falls. Reduced flexibility of muscles, decreased walking speed, poor recruitment of our balance strategies. So just thinking, if you do start to get unsteady, you try to correct yourself. If you can't do that appropriately, then that's going to increase risk for falls because we can't catch ourselves like we need to. And then reduce sensation like we were talking about earlier. So, before I start to talk about balance strategies, I will say that's a lot of things that we just covered, but they're all health related. So, again, if you are noticing any of these things occurring, even if you haven't had a fall or you don't feel like your balance is necessarily affected at this time, Still let your doctor know whenever you go in for your routine visits, like, hey, I have noticed this, and this, so that it can be addressed appropriately if need be. It's always easier to try to get ahead of a problem than addressing it after it's been going on, for 6 months, a year. It can still be addressed, but it's early if we can be more prepared, I'll say. So next thing, talking about balance strategies. So that's going back to, if you do start to become unsteady, can you recover your balance, as I was stating earlier? There's a few different ways that we work to try to recover our balance if we get unsteady. That's using our hips, our ankles, and then being able to take sudden steps to recover. So this next slide is about gait assessment. So going back to just gait speed and how that can affect balance. If we have a slower gait speed, we're walking at a slow pace, then research has shown that that can increase our risk for falls. So we have listed some research here. Gait velocity less than 3 feet per second has a 28% increase in risk for falling, and gait speed less than 2 feet per second has a 54% increase in risk for falls. So whenever we are assessing people for balance, gait speed is one of the things that we will regularly look at. And if we notice that it has been affected, it is slower, that's one of the things that we try to work on, because especially being out in the community, you want to be able to walk at an appropriate speed to get past obstacles or adjust your speed when needed. So say you are walking in a busy environment, maybe you need to walk faster, you need to walk slower. You need to avoid traffic that is coming as you're crossing the road. All of those things can be affected if we have a slow gait speed or we're stuck at one speed, and then can increase our risk for falls. Next is talking more about some risk-taking behaviors, and Sarah's going to talk more about this later, but this is another big thing for how can we prevent falls or reduce that risk for falls, just trying to be smart and think ahead. Especially if we are starting to experience some unsteadiness, sometimes we have to modify how we have done things just to make ourselves safer. So some personal behavior modifications that can be made if you do find that you are unsteady or you've experienced some falls. Trying to avoid loose fitting clothes, especially thinking about like pants. If they're falling off of you, you're tripping over them, tripping over the legs, getting something that's a little closer fit could be helpful. Choosing proper fitting footwear, maintaining an active lifestyle, as we've already been discussing. Using caution with your pets, especially if you have a little pet that loves to be right under your feet. I've had many people that have said they've tripped over their dog whenever it's been behind them and they didn't realize it, or their cat's under their feet. And sometimes there's only so much that you can do for that depending on your pet, but at least being aware of that and trying to take some precautions when you can. Trying to pre-plan activities, especially if it involves something that might be challenging to your balance. Giving yourself enough time to do that task so you're not rushing is a big thing. So one big example I will give for that is going to the restroom. A lot of people that I have worked with have issues getting to the restroom in a timely manner, but they will maybe wait a little longer than they should before they start to go. If we're trying to hurry and get to the restroom, that can increase our risk for falls. So just kind of pre-planning things like that in advance. Ways to avoid high-risk situations. Take your time. especially if you are getting up maybe to answer a door, answer the phone, going to the restroom. Avoid reaching outside of your limits or your base of support. So instead of doing a big reach for something on another counter, maybe take a step closer to the counter and then grab your item so that you're more steady. Slowly transitioning from lying down to sitting up or standing up. Sometimes people will report having dizziness with those movements. Sometimes that can be blood pressure related. So again, it's good to let your doctor know if you're experiencing any of that. But some things that can affect that are hydration as well. So whenever we are making transitions, giving yourself some time, pause, see how you're feeling before you stand, and then again before you start moving off from your chair or your bed to walk. Make sure that you don't feel dizzy, and if you do, stop, sit down, or at least pause where you're at before you start moving further. Medication management, so try to keep a list, an accurate and up-to-date list that you take to all of your appointments so your doctors know what medications you're taking from all providers, so that if there are any medications that interact negatively with one another, that can be addressed. Making sure that you read your labels, read your side effects so that you can be aware if there are medications that are going to potentially cause some dizziness. Follow the instructions that are given by the pharmacist on how to take that medication properly. Familiarize yourself with the side effects, like I said, just to be as safe as possible. If you are trying to be as safe as possible, but you still have a fall, what do? Some big things to think on is you had a fall, you're in the floor. First off, don't panic. Don't try to get up super quickly. Take some time, you're already in the floor. Assess yourself, see how you're feeling. Are you having any dizziness? Did you hit your head? Do you have anywhere that's bleeding, that's hurting? If not, then we can try to slowly work our way back into standing as is shown in the pictures. And don't be afraid to ask for help too, especially if you have someone with you. Sometimes people will try to hop up on their own, but if you are questioning whether you can do that safely or not, it's always better to ask for help first. Fall alert devices, very important, especially if you do live alone, so that you can alert someone to assist you if needed. Medical alert necklaces, alert watches, a lot of smart watches have fall technology on them now, which is great. And then applications on your phone. If you don't want to get these medical alert devices, always have your phone with you wherever you go.
We are going to talk about home safety, and we're going to go room to room. We will start in the kitchen. In the kitchen, make sure that you have stuff at height so you're not reaching way above or reaching out of your base of support like Lauren has said. Making sure everything's at the counter level. You don't want to be bending down a lot to get things out of the cabinet. So things that you use most commonly, try to keep on the countertop. Also, no step stools. I don't know how many people have step stools in their kitchen, but the things that are very high up, maybe if you have a family member that comes over, have them get the stuff down that you need, that it's high up in the cabinet, so that you're not using a step stool to get that out, because sometimes that kitchen stuff can be heavy. Pots and pans and dishes, they can be heavy and you don't want to be reaching up and trying to grab them out of the cabinet and then lose your balance. So just keeping stuff at a level that you can reach, and no step stools. Move your feet, like Lauren said just a second ago. Instead of reaching to grab something, say you're trying to get a spice out of the cabinet, don't reach to get it, move your feet. Even if you have a counter and then you've got an island or whatever, move your feet to put dishes into the sink, or move your feet to grab something out of the cabinet instead of reaching and out of your base of support, because that'll make you fall. No rugs. Who likes rugs in their kitchen? I know, we all have the padded rugs at our sink, right? To make our feet comfortable, and if we're standing there for a long time doing dishes. I don't know about you, I don't like doing dishes. But no rugs, because you can trip on them, or if you have an assistive device that you're using in your kitchen, it can get caught, and that can make you fall. The bathroom. I'm sure some of you guys have some things in your bathroom, such as adaptive equipment or assistive devices to help you in your bathroom. So some things that we often recommend for our patients are shower seats. So instead of standing for that whole shower, if you have decreased endurance or you get dizzy while you're standing, it just is sometimes safer to sit versus standing for the whole shower. I also like shower seats too for tubs. Not everybody has a walk-in shower. Some people just have the standard tub with the shower, and it's hard to step into the shower. That will put us at risk for falls as well. Having railing in the bathroom. Who all has railing in their bathroom to help support and to pull up? Yes, having railing is great. A lot of people suggest bolting it into the wall instead of having the suction cup ones that can come off. I highly recommend having the stable railing to get up off the toilet, or to even have in the shower to hold on to for safety. Raised toilet seats are also recommended because it makes it easier to stand up. A bedside commode can be used as a elevator on the toilet seat if you just put that over, and it gives you railing as well. I've recommended that for multiple patients. Handheld shower head for in the shower so that you can sit, and it makes it easier to wash yourself off. It just makes it easier when you're standing and stuff to have something that's a little bit lower. And some you can move down lower instead of having way up so you're not reaching for it. Non-skid flooring. So how many people have been in a bathroom where it's wet and it slips? I have 4 kids, and I can't tell you how many times they fall in the bathroom after getting out of the bath. So make sure that you have something that's non-skid, that even in the shower too as well, tile can get very slippery. So putting the little non-skid mats, not gonna say rugs, on the floor will help as well. The bedroom. So we consider having a bed rail. Sometimes it's hard getting out of bed. I've had a lot of patients that have rolled right out of bed, and they either hit their bedside table or they hit the floor. Even when you get up and you're sitting on the edge of the bed, you've been sleeping all night, and Lauren's talked about, taking that time to go from lying to sitting. Sometimes when you're sitting there, if you're dizzy, you can have something to hold on to. Look at your mattress height. So if it's too high and you need a stool to step onto, that can create a fall risk, okay? Having to step up onto a stool to get to your bed where it's easy to sit on, and you don't want it too low to make it hard to get up out of bed. Avoid sleeping in recliners. Don't know who sleeps in recliners. But that creates decreased mobility in our hips, creates back pain, and with those decreased mobility, decreased strength, and then as Lauren mentioned earlier, it leads to an increased risk for falls. At night, that decreases our vision, and if we don't have that vision and that sight, then that is one of our sensory inputs for our balance. And then also in the middle of the night, you guys are probably going to the bathroom real quick, and you don't want to run into something or trip over anything. So having a nightlight is very important. And Lauren had mentioned before, plan before it becomes an emergency. Consider using a ramp if stairs are hard, or if you do have stairs, make sure you have railing to hold on to. Also helps decrease risk for falls. Avoid uneven pavers outside, or if you're gardening, using a stool to sit on instead of bending over. Clear the path, so this is for outside and even inside the home. If you have a cluttered house, you have a lot of things around, make sure that you have a clear path from one room to the other. Pets and toys, oxygen tubing. So that's another one that we look at, is if anybody's on oxygen, even at night, make sure that you have enough tubing to get from one room to another, or you guys are holding on to the tubing so that you don't trip on it. Pace yourself, or even if your phone rings and it's in another room, don't rush yourself to go get the phone. Take your time, you can always call that person back. If the doorbell rings and you rush to the door, that can put you at an increased risk for falls as well. And good lighting, and then always ask for help. And there's a checklist that you can look and you can go through each room of your home to kind of check to see what kind of risk factors you have. It goes over the stairway, the bedroom, the kitchen, the bathroom, kind of what we just talked about, and even outside. Choosing the path of least assistance. So when we look at a patient, we assess all their sensory inputs, we assess their balance, we assess for the different strategies that you have, and then we also look at their walking pattern. So we analyze their gait. And there's different stuff that we look at when we look at their gait, and we look at their stride, we look at arm swing, we look at trunk rotation, we look at double limb stance time. So all of those things can be affected by your mobility, your strength, your endurance, all the things that Lauren mentioned earlier. And so we look at these things, and then we look at if you are appropriate for an assistive device, because there's so many different considerations when choosing an assistive device. Some of the different assistive devices are a walker, a rollator, that's what has a seat and then it's got 4 wheels. Canes, there's multiple different kinds of canes. You have a 4-prong or a 3-prong, a wide base, a hurricane, a straight cane. There's so many different types of canes, and then we have trek poles, like hiking sticks. And so the best practice is to, if you feel like you're at fall risk and you feel like you need assistance while you're walking, talk to your primary care doctor or come in and get an assessment from any physical therapist, okay, that can look at your walking pattern and suggest what would be the most appropriate for you. Assistive devices can help improve quality of life. They can help with your mobility. They can increase your confidence in the community when walking around. They can decrease your risk for falls and also reduce compensations. Say you're weak in the hips and you lean from one side versus the other, you can use a cane to help stabilize you. You have decreased endurance and you can't make it very far. You can use a rollator to help you with those further distances and have a seat with you to sit. Because when you do get tired and weak, that puts you at higher risk for falls as well. All right, choosing good footwear. Making sure that your shoes have a backing is very important to help stabilize that foot. So you're not focusing on trying to keep that shoe on. Also having a good sole, not a worn down sole, because that can make it slippery. You want a good traction on the shoe. But also you want a shoe that is firm and not squishy. A soft sole is what we call it. And you want one that is not a thick sole. I know some shoes these days have really thick soles, but that adds cushion And it almost takes that proprioception that Lauren was talking about earlier away and decreases it, so it puts you at a higher risk for falls. So you want a firm sole is better than that thick, cushiony sole. And then making sure that there's a backing, no Crocs. And then also why we wear good shoes, to decrease falls, foot health, and prevention of injury up the chain. So if you don't have good support in your arches, then it could lead to knee pain, hip pain, back pain, okay, and then that could put you at a high risk for falls. Having good balance is multifactorial. We've talked about the different sensory inputs. We've talked about how important it is to keep moving, keep your strength, your endurance, mobility in the joints. So exercising is very, very important. Some common exercises to help with strength and flexibility. Standing up and sitting down, so doing sit-to-stands, calf raises, calf stretches, hip stretches, weight shifting from heel to toe, and then step-ups, either up onto a sidewalk, up and down, or if you have a stair at home, managing your medicines, making sure you're on top of your medications and taking them appropriately, and doing home checks, making sure that you are taking away the clutter, removing the rugs, and not creating any extra external things that could make you at high risk for falls. And then avoiding poor footwear and using the most appropriate assist device. Because sometimes we will just get suggestions to go get a cane, and then it's not at the right height, or it's just not the most appropriate one. So making sure that you have the most appropriate assist device for you.